Colleagues, as many of you know, today marks the beginning of National Nurse Week, and it seems fitting that a retired nurse and a longtime ONA member talk about the importance of nurses in our community. My career was spent working with programs like Babies First, Maternity Case Management, and the Cocoon Program that serve thousands of vulnerable pregnant women, children, and youth that are at risk for poor health and developmental outcomes. Programs that save millions of dollars through preventative care and pull down millions of matching dollars from the federal government. So as we honor Oregon nurses this week, I encourage my colleagues to consider the compassionate service they provide to our communities and the programs that empower them to support our most vulnerable citizens.
Colleagues, this is National Nurses Week. National Nurses Week starts on May 6th and ends on May 12th. And May 12th is actually Florence Nightingale's birthday. And I am a proud public health nurse, a longtime Oregon Nurses Association member. ONA represents almost 15,000 registered nurses and advanced practice nurses working in almost every imaginable setting throughout the state. Colleagues, we need to support a budget that continues crucial investments and fully funds nurse-led public health programs that both mothers and children in our communities depend on for care.
Colleagues, as you know, this is Nurse Celebration Week, and it's particular to me because I celebrate today my daughter Sarah, who is a Providence cardiology nurse helping to save lives on a daily basis, as are the nurses throughout Oregon helping to save our constituents. So let's honor those nurses today.
And I'm sure that many of you, or all of us, have been touched by nurses at some point. I know that I have, and it's not just because I've had the privilege of working for a nursing organization. This morning, given that my husband and I have 2 teenage children, I'd like to give a brief shout out to school-based nurses who work in school-based health centers. School-based health centers are a patient-centered, evidence-based healthcare model where children and adolescents receive comprehensive physical, mental, and preventive health care regardless of their ability to pay, located on school grounds and during school hours. We know that healthy kids learn better, and when we can support students with comprehensive health care on site, they can stay in class and then learn more effectively. I want to thank all the nurses that I've worked with and all the nurses and nurse practitioners in particular around the state who do incredibly important jobs in our school-based health centers. I know that my 2 teenage children feel the same way, though I'm sure that they're mortified to know that yet again I'm talking about them on the House floor about their health.
Thank you, Mr. President. Colleagues, I too want to celebrate the contributions of nurses for our communities, with a particular focus on nurse practitioners. And I do that because my own daughter is a nurse practitioner and has been for the last decade. You may know that Oregon is a national leader in advanced nursing practice. Nurse practitioners have consistently proven their ability to deliver high-quality care, and many studies show that when it comes to primary care, nurse practitioners can deliver care as well as physicians with tremendously high patient satisfaction scores. Oregon should work to remove any barriers that prohibit nurse practitioners from performing at the top of their scope of practice. And colleagues, we should also try to invest as much as we can in nursing education. My daughter was a National Healthcare Scholar, and the federal government paid for her advanced nursing education. I can tell you, colleagues, that that investment has been repaid many, many times, including the taxes that she's paid over the last decade, but also the many contributions and the many hours of service she's provided. Colleagues, please join me in recognizing the service of nurse practitioners.
It's because nurse practitioners and healthcare advocates have taken an active and vocal role in policy that we have increased access to care for Oregonians through nurse practitioners. Nurse practitioners are major players in our Oregon health system in both primary and preventative care. And on a personal note, I missed the extraordinary service I received for 3 years, 2 years ago, from a nurse practitioner.
I want to join my colleagues who have spoken all week about National Nurses Week, and I want to highlight, if you'll indulge me, one specific nurse, my mother, Margaret Williamson, who's been a nurse for 50 years. And, I grew up knowing she was a superwoman, an incredible caretaker, and a really powerful woman. And I think she is a great example of who our nurses are in this state. And there are countless men and women who provide this kind of service and care to Oregonians. And so I wanted to highlight her and have you all think about the nurses in your life today. Thank you.
In general, in my career as a physician, obviously nurses have been critically important to me. Without the remarkable care that they provide as part of the healthcare team, we couldn't really make the difference that we do in patients' lives. And it's been a real privilege over the course of my career to watch nurses' roles expand into much more complex aspects of case management. On a very personal note, I am strongly connected to nurses because I married one. So thank you to all our nurses out there, and in particular to my husband.
Since this is National Nurses Week, I want to kind of give a shout out to all of the nurses because they've been doing a lot of fantastic work. One nurse in particular, as a young lady by the name of Wendy Simpson. Wendy Simpson is my sister, and she is a registered nurse, and she has worked double shifts every day for the last 5 years. So when we go out and we look at the work that the nurses are doing in our local communities and across this nation, it would be a disservice for us not to recognize all of the work that they've been doing in terms of health care that they're providing over and beyond expectations.
In my time at the legislature, I've consistently witnessed the power of nurses who advocate on behalf of their patients and their practice, and this long-term strategic effort has translated into real policy victories over the years. Colleagues, please join me in recognizing the tremendously vital role nurses play in our healthcare system and advocating for policies that advance safe patient care and expanded care for all Oregonians. Thank you.